So, good morning, everybody, and hopefully everyone was able to dig themselves out. I had the mayor on yesterday. We talked about being patient. It was a tough snowstorm, and we'll get through it. Like, we're getting through this COVID-19, working together and finding, answers for our solutions, or solutions to our answers, and to make sure that we get through it. But I just want to remind everyone that at the Albany Airport, saw over 22 inches, making it the 8th largest storm of all times. So if you think of it that way, this is one of the big 8. So some of the areas of the county got hit harder, though. It looks like parts of the hill towns, Bethlehem, New Scotland, saw around 30 inches. So I drove around yesterday up in the hill towns. Our DPW did a great job. The towns out there did a great job. So again, to the men and women that are out there keeping our streets clean and trying the best, we got to work with them together, and make sure you dress warm. When you're out there, it's frigid, it's cold, and on top of that, with all the snow, and take your time digging cars out and shoveling your driveways, because unfortunately a lot of people end up with heart attacks or other issues. And it's a good thing we got Dr. Lombardi here, so we can talk about a variety of stuff other than the COVID-19, to make sure you do it safely. And that's the most important thing. Give yourself plenty of time to dig your cars out. And I know some cars you can't even see in the snowbanks as you go down the street. So I want to remind, there's still city emergency on parking in the city of Albany. I know Watervliet has it, so please, people, check with your respective towns, villages, and cities to see if you have restrictions on parking and other things. It's important so you don't get your car towed, and if you can't dig yourself out, just let the town know where you're at, or village, so that they don't hit your car, because the plow sometimes can't see it when they're buried in that much. So. And we'll get through it. So just remember that you'll need to have your cars on the odd side of the street by 8 a.m. tomorrow morning. That's here in the city of Albany, so the plows can do their job. And it was quite the snowstorm we got through. But again, but to start the press conference off on the COVID-19, I can assure you, I sit here and you look at any light at the end of the tunnel. It's the fact that I don't have to report anyone passing away last night. It's been tough. It's been tough for the families. It's been tough on us. So I'm glad to sit here and say that we don't have to report anyone passed away. Some other good news: the FDA advisory committee recommended that distribution of the vaccine for the FDA could officially authorize the vaccine going out to everyone. That's what I talked about earlier. The Governor Cuomo was talking about, and it's like 350,000 vaccines that will hit us here very shortly. So that was good news that got out. We also saw Vice President Mike Pence take the vaccine, which will go a long way with a lot of people that don't believe in the vaccine or think it's fake or there's problems. Which is good. But today in Albany County, there's 8,747 cases of COVID-19 in Albany County to date. That's an increase today of 220 positive cases since yesterday. This is the second day in a row we had a single day increase over 200. As you remember, yesterday was 222, today is 220. It's here, it's going up, and we're going to see these numbers unfortunately continue to grow over 200 for the next couple weeks, especially with Christmas upon us and all the other holidays. Currently, there's 3,237 people under mandatory quarantine. Of the new positive cases, we know 22 had close contact cases to people that were positive. 22 are healthcare workers, and 176 don't have a clear source of infection. Like I said yesterday, it's going to take time for our epi, for our investigators, for everyone to get through this because of the amount of numbers that we're having. It's just not here in Albany County. Unfortunately, it's across the state and in the capital region that these numbers are extremely higher than we had 9 months ago. So again, we continue to break records. We continue to see these high numbers. So to everyone, please be patient. We will get to you. But you can always go to our website for guidance. You can go to the CDC website for guidance. You can go to New York State for guidance. Everyone puts out there the protocol. Stay in for 14 days. Write down who you're around. Help us do our job, and we'll get through it. Unfortunately, over the last 5 days, we've seen an average of 195.8 new positive cases each day. Yesterday it was 186.4. As of today, 30,134 people now have completed quarantine. And of those, 7,110 tested positive for the virus and have recovered. As of today, we have 175 new recoveries since yesterday, which is good news. But so while it's good we're seeing high numbers of recoveries, our new daily positive cases are still too high, which increase the number of active cases in the county. Unfortunately, breaking another record today, there are now 104 people currently hospitalized. Yesterday it was 100, so we got 4 more people in the hospital since yesterday. And we were at 96 before the 100. This is the second day in a row that we had a record number of people in the hospital at one time because of this virus. Hospitalizations have been trending upward since December 13th. We keep pointing that out. There were 14 new hospitalizations overnight. Like I said, though, people go in, people come out. But there was 14 new people that got admitted. Unfortunately, too, hit another high. 21 people are currently in the ICU. So yesterday it was 18. The day before that was 15. So this is a high for us to have patients in the ICU to have 21. So unfortunately, we're seeing more people going to our ICU and more people going into the hospital with higher numbers. So please, I know we got COVID-19 fatigue. I know people are tired. I know they think the vaccine's here. I have the doctor here to talk about this. It's going to take time. We're almost there. We're almost out of this. But it's going to take a few more months. And I know people don't want to hear that. I know when the snow hits, some people get depressed because now you got to stay in more. We'll get through it. But you have to continue to wear your mask, to cough into your arm, to clean your hands, and to stay 6 feet apart. Or unfortunately, this is going to continue to get to a critical mass where our hospitals are going to have an issue with, with hospital beds and ICU beds and capacity issues like we're seeing around the rest of the country. So please keep doing what we're doing right. To the people that are doing the right thing, thank you, thank you, thank you. But to the people that don't believe it's here or don't want to wear a mask, please just do it for other people. Don't do it for yourself. Do it for other people. You want to protest? Protest later down when we're through this and about have to wearing a mask and everything else. And we'll continue to get through it. Like I was saying, sadly, yesterday's the other record for a number of people in the ICU. The last record was 19 back on December 9th, just to give you an idea where we're at today versus December 9th. And as we talk about the microcluster zone, that's why I continue to monitor the hospitalizations to get in different zones. We got a lot of feedback on this. I'm just trying to stay abreast of how this information, how they're looking at us versus other areas of the state of New York and the different zones. But it's based on the hospitalization beds, as I've continue to say, and I think we're like at 20 to 25% right now, a little low, probably closer to 20% for hospital capacity right now. And I know the different zones gets to 15. We got to continue to monitor it, especially with these high numbers we're having with people staying in the hospital and the ICU beds. So that's the best way I can explain it. And again, as we get guidance from the State Department of Health and how they're addressing this, or I continue to do it in our control room, I will put it out to people and let you know what they're telling us. So, we constantly encourage people to go get tested. One of the great resources we have here in Albany County is Central Med Urgent Care on Central Avenue. We've seen our infection rate go up. We've seen a huge surge in the number of people going to get tested. And this is having an impact on our availability of tests. That's what we're hearing from other places. There is a shortage because so many people are going to get tested that it is a shortage. So please, be patient. We're also seeing mixed reports on the accurate of rapid testing and other rapid tests. People can, talk about, is it accurate, is it not? This one's 95%, this one's 90. But so I thought who better than to bring a frontline doctor that's out there in the community doing this since it's happened. A new business he just opened up on top of that in the middle of this COVID-19 world. But I want to bring in Dr. Liberty, who is the CEO and Chief Medical Officer of Central Med Urgent Care, to talk about this. So, Doctor.
Thank you so much, Mr. McCoy. Good morning, everyone. Um, I think from what Mr. McCoy has been saying, and from what we all have been witnessing, we know that COVID-19 is not something to play with, and it's not something to joke around with. It's here, it's devastating, unfortunately, but at the same time, we are out there trying to do the best we can to identify those folks who need to be identified in terms of positivity and whatnot. So, like he said, we opened up the business back on the 23rd of August of this year. At that time, I mean, this was in the middle of the pandemic. But then, ever since, this is pretty much all we've been doing. We've been fighting this COVID from front line in terms of testing capabilities, in terms of treatment modalities and whatnot. So we've been just out there. Now we've seen a lot of variations. We've seen in terms of reaction from patients. So we've also seen a lot of variations with testing and the results. There have been many discussions about rapid tests, about PCR, and about the accuracy. For us at Central Metrogen Care, we do lots of rapid tests. We also do PCR tests. We also do the antibody tests as well. So everything related to COVID, that's what we do. Okay. So now, if we have to talk about accuracy of tests in general, so I think we have to probably define what we mean by accurate. So accuracy of tests, it had different connotation and different meanings, to each test. I think right now, the gold standard is the PCR, which is okay because that sort of identify the genetic material, and a lot of the time PCR is pretty much the gold standard for most infectious diseases in terms of testing. So for us, we do a lot of rapid tests, and a lot of the rapid tests we do. And just for the record, I'm not a spokesperson for any company, but the rapid tests we do at our urgent care center tends to mirror almost correctly, almost 100% with the PCR. That's what we found. I mean, we've done thousands of rapid tests, and we've done numerous, just correlation just to make sure we are doing the right thing. I think at the beginning when we started, we were just sending confirmatory tests with the PCR, and what we were seeing was, wow, this correlates. And then we started, and then we stopped, sending the confirmation tests. But now we still send confirmation tests because of patients' requests. They say, well, we've heard the rapid test is about 75%, it's about 80%. So I tell them, well, our rapid test is a little different, because we have almost about 100% specificity and about 96% sensitivity, and it's been proven numerous times, with a lot of patients that ask for confirmation, but at the end of the day, we still have to go with the guidelines. We still have to, conform with the state guideline, which says if you have a rapid, if you have symptoms and your rapid test comes negative, you follow that with the PCR. That's fine. We still do that. Now, some of the variation actually we've seen, in the just being at the front line and getting these things done, is that this is not scientific experiment, but this is observation, and I can't give you any percentage, but we've actually been seeing more and more patients testing positive in their second week of exposure, than at the beginning, So, which is why I think the New York State guideline, which is about 10 to 14 days, I really think it is very inconvenient for folks. It's very, very just people don't like that. Nobody wants to say 14 days, but I think if we really, start to adhere to that, we will see that, I'm not going to generalize that the infection rate will go down, but I said we can start seeing some improvement because we are seeing lots and lots of positive results the second week of infection. So whether it be PCR, whether it be rapid test, and like I said, almost when we do a test, it's almost in correlation, with the PCR. And when patients ask for it, we do it. I said, but I'm going to tell you right now, the result is going to be the same. And then, call them back for the result. They say, oh yeah, you said it, doc. I said, I know because I've been doing this. So this is not to discourage anyone from doing. Like I said, we still have to follow the guidelines. We still have to follow the standard of care. But for those who want to say, well, I've done 7 days now, let me go out there and go about and do my own things. I really urge and encourage them to get tested, before they go out there, to the community, because again, we've been seeing, one of the surprising variations we've been seeing is more and more people testing positive in their second week. Now you wonder, why is this rate, going up? Well, again, I'm not going to generalize, but I'm saying that from our standpoint, what we're seeing, this is what we're seeing, and most times according to the guidelines, we tend to release these patients from quarantine or from isolation and just say, just go out there without, not retesting. Okay, so that's the guidelines, and we have to follow through that. But I do encourage patients, if you think that you are not 100%, I know you've done your 14 days, you've done your, how many days that was recommended, and you just feel that, trust me, you will know if you don't feel right. There's no two ways about it. If you don't feel right, you will know. If you don't feel right, just let us know. And then we've tested a few patients who was exposed about 17 days prior. So we see lots of variation out there. But generally, the PCR, again, this is the gold standard. We do that, and then we also do rapid tests, which is very, very highly when you compare it to the PCR. This is very, very, in terms of that point of accuracy, which is why I said at the beginning, it depends on what you mean by accuracy. They do correlate well, for the most part.
Doc, I actually have a couple questions for you, because you bring up a good point. Because I know this girl Jenny, who does the right thing, double mask, stays away from everybody, stays more than 6 feet away from everybody, and someone in her family got it, and she isolated for 14 days, took a test just to be on the safe side, was negative. So for whatever reason, she wasn't feeling good over the weekend. Now she actually would have been completing her 14 days on Monday. Mm-hmm. Went on Friday, did a rapid test, and now she's positive. And she's like, I haven't gone out. I haven't left my house. And you bring up that point that just because you're negative in the beginning doesn't mean 4 days, 5 days later you're going to be positive. Correct?
Yep. Yeah, and this is what we're saying. I didn't even know about her, but this is exactly this is what we're saying, and we just have to encourage everyone out there, just stay safe, do the right thing, wear your mask, stay 6 feet from one another, wash your hands, and if you're sick, call your doctor. If you don't know where to get tested, I think the county website has a different sites listed for testing, and I think this will, I know we have a tendency to get tired with things that is so prolonged. So, I think McCoy call it, we call it COVID fatigue. It's COVID fatigue. It's everyone. So if you think you, as an individual, you have COVID fatigue, so what do you think about the provider, about the front, workers who are out there, trying to, make sure we are on the right path, to clearing this illness. So I think everybody we all have part to play. We just have to be honest with ourselves. We have to be honest with our communities. We have to be honest with our friends, and we also have to be honest with what it is that we have to do. That's another thing that we are seeing as well. We see patients come in. They said, well, I had 2 friends over yesterday, and then one of them tested positive. I said, how do you find out? Well, he just told me and said, hey, I did a test 2-3 days ago before I came to your place, now I'm positive. So those are the things we see a lot of those stories. So my advice would be before you go to any gathering, if you are having a test, you have to let those folks know. Say, hey, listen, I just got tested 3 days ago. I don't have my result. I probably should have been here. I'll wait until my result comes. Again, that's part of being honest with yourself, and that's part of being honest with your friend. Because at the end of the day, what happens is you don't do it for yourself. It doesn't even have to be your friend who is infected. It's going to be their grandparents. It's going to be, somebody else who is immunocompromised. It's going to be their friends or their family. It's just a lot. It's a snowball effect, and we are seeing a lot of those variations. I mean, you have a couple who comes in. One of them was exposed to somebody who was exposed to somebody, but they didn't get it. But then the other couple got it, who has never really left home. So I cannot explain the science behind it. Nobody can explain how. So which is why we've seen this many infectivity, just because this virus does not behave the way we think it should be behaving. It doesn't behave the way any virus should be behaving, actually. So there's so much unknown about this, but for what we've known and for what we've been doing over the past few months, we know to say that please keep your distance. Please don't attend any gathering. Please, wash your hands. Please use your face mask. It's just repetitive. I've been in this for the past 9 months since the beginning, both the inpatient and outpatient. I've never tested negative. I've never tested positive. I don't even have the antibodies. Why? Because we're using you've been precautious. So you have to use it. And I've tested thousands and thousands of these patients. So if we just do the minimum things, just the minimal things, you trust me, it goes a long way. A long way.
I just got another question for you, and I know probably reporters are going to ask this question too. The vaccine, how do you feel about that? Because there's been so much negativity about it coming out too quick, people who don't want to get it, people are scared of saying they're going to be the first guinea pigs to get it, and I know we're trying to put the message out there that it is safe, but what's your point of view on it? And not to put you on the spot,
no.
And I apologize for saying that, I should have said something to you beforehand, but I'm just kind of curious because I keep getting so much feedback from people like, I'm not going to take it. I refuse to take it. It came out too quick. But this is going to be the difference of wearing this for another year and getting out of this or getting the vaccine. What do you
That's a good question, actually. Just for the record, we're going to be one of the sites that will be doing the vaccine. So just to let you know. That's number one. Number two, for those, I think people have legitimate reason to be apprehensive about vaccine just because the way, the speed with which it was done, I call it warp speed. But as a medical provider, as a medical professional, I don't think there's really, you can't have that anxiety, but I don't think you should be afraid to take it. I think first of all, this is not a live vaccine, so you're not going to get the virus. The virus is not going to be injected at all. This is genetic material of the virus that typically going to be given to you. The way the vaccines actually work is you get the vaccines. The goal is to trigger, because the virus itself is an mRNA virus, what we call mRNA virus, and then what happens is when you get infected, it releases a spike protein. So the goal of the vaccine actually is to elicit the body response to that protein, so that it will prevent the mRNA from entering, from going inside the body. So it's not that it's going to change your genetic makeup like some might think. It's not going to change anything. Okay, so what it does, once your body responds, once your body identify that there's a foreign body in there, so what the body does, just kind of produce antibodies. So the antibodies will now attack the protein, and the genetic material send them out, and then the antibody stays there, ready for another virus to come in. So that's just basically nurture. That's the process, and it is safe. I mean, this was started back in the UK a week or 2 weeks ago, and they've tested about close to about 200,000, and they have 1 and 2 adverse reaction from those who have some history of adverse allergic reaction. So other than that, this is so far this is a very safe vaccine, and I will be taking one. Like I said, I've never been infected. I've been practicing what I preach, and this is going to be one of it. And I will take it as soon as we get it from our, in our urgent care center. So I just think for those of you out there that's very, really apprehensive, that's really, really afraid of taking these vaccines, I don't think there's anything to be afraid about. This is, if anything at all, this is going to stop us from living the way we're living now. So if you're tired right now, so imagine how you're going to feel for the next year or two without the vaccine. So I think we have to sort of weigh our emotional response to the scientific data and try to make the right decision. I think it's up to us, the medical professional, leaders, to make sure we push it up there and say, hey, this is not as bad as people make it to be. This is not as bad. Yes, yes, it was done in a warp speed. I think the other thing people tend to forget that we live in the 21st century, and in the 21st century now we have 5G. So, what I'm trying to say, technology, everything has advanced. So you don't really have to wait, to produce a vaccine for 10 years, just knowing the kind of technology, how advancement we've been over the over the past decade. So I really don't think the speed of the vaccine should be a worry. If anything, I think what should worry people is how the accuracy, or rather the of the vaccine. That should really worry people, how people should respond to it. But I think this is quite safe, so far from what we've seen.
Thank you, Dr. Liberty. I appreciate that because, I've had numerous conversations within my office with the Black Caucus and our leaders, Bill Clay and Wanda Willingham and Norma Chapman, Bert Simpson, and Carolyn McLaughlin and Sam Fine, with the issue of people just being nervous about taking it. And we do need to do a better job educating everyone. It is safe. We have to get it out there. You have to take this vaccine if we want to get into some type of normalcy by the springtime. If not, it's going to go into fall, and if most people don't get vaccinated, it's going to continue on, and to either it goes away or you build up an immune system towards this awful COVID-19 that we're dealing with. But I do want to remind people, testing's still available at the Times Union Center Monday and Friday. So please make your appointments in Waterville Administration Building. We're going to be doing that this Wednesday with Whitney Young. Please, if you need an appointment, call 518-465-4771. And if you don't have insurance, don't worry about it. We pay for it, and we're going to continue to pay for it for people who don't have health care. So please, we don't want you to worry about that. Same thing with you, Albany. You can call that number as always, 1-888-364-3065. I do not think they're up running today because of the heavy snow, but just check our website at albanycounty.com and go there, and we put up there if they're closed or canceled because of the snow. You got to give people time to reopen and get there safely. Also, you can schedule appointments with UAlbany, Price Chopper, CVS, Priority One, and plenty others, and we'll get through this. So please, if you need anyone that needs mental health support, call our number 518-269-6634. Again, I know it's a different world we're living in. Take a deep breath, take a step back. Remember, it's a marathon, not a sprint. And we're going to get through it, and it's just going to take time, and it's going to take a lot of time into 2021. But we'll get through it, and because we are resilient, and we'll get through this in a partnership. So also our 24-hour sexual assault hotline number is available, 518-447-7716. Our 211 number with United Way and New York State hotline is always at 1-888-364-3065. Please, if you do anything, just wear your mask, cough in your arm, clean your hands, stay 6 feet apart, and stay safe and healthy.